Guys,
Right.
Hi,
Hi,
how are
Zamil. How are
you?
you?
good. Hi, guys.
Hi, Zamil.
You can hear me out. Good. That was a good workout.
Yeah, indeed.
Okay, Zamil. All right, I am going to make you a co-host.
Okay.
Yes.
Just
So now you can try and see if your slides work, please.
okay. Just a second here.
We're just doing a test run for the main
Oops.
event.
Okay, perfect. Here we go. Okay, share.
We see how to keep a digestive system
Yep.
and liver. Keep a healthy
Perfect.
digestive system and liver. Yep.
Okay,
Yeah.
you guys can see all that? Okay, great. Let me just turn my light on here just a second. Yeah.
Okay. Well, that was great. I'm going to step away for a moment.
Okay, Colin. In the meantime, I'll just talk about Zamil a little bit.
Sure.
Hello, everybody. This is Dr. Zamil Karim. He's my nephew. He's my sister's son. And he's in Vancouver, and he's agreed to do this Zoom for us. So thank you very much, Zamil. I will mute everybody once he starts. And then if you have questions, please put it on the chat or raise your hand. But please wait till the end of the session. And if you don't know how to use the chat or hands up, you can unmute yourself and ask the questions because some people are not comfortable doing that. All right, so I'm going to mute everybody now and go from there.
Okay. Okay, great. Okay.
Zamil, you'll have to unmute yourself. Zamil? Zamil, we can't hear you. Zamil?
Perfect. Okay, everybody can hear me now? Sorry.
Yes, yes.
Okay, wonderful, wonderful. Okay, so let me just start from the beginning. Okay, great. Yeah, so thanks everyone for the invitation. Yeah, honored to be here. So as mentioned, so I'm a specialist. I'm a gastroenterologist and a hepatologist. So basically, what that is a specialist of the stomach and the digestive system, and also of the liver. So I practice out of just outside of Vancouver. I've been here for about 13 years. I practice at Surrey Memorial Hospital. One of the suburbs outside of Vancouver. I did a lot of my training and medical schooling at the University of Toronto. So I have lots of connections there, and then my family's there as well with my Nazwa aunties there. So I have lots of time at the end of the presentation for questions. So I'm going to just kind of go through, and then I'll take all your questions at the end. Okay. So the presentation today is to talk about how to keep your digestive system and your liver healthy, especially as we age. There's a lot of sort of issues that can develop as we get older with our liver and our digestive system. And so this is a presentation on how to keep that healthy. So today we'll be talking about colon cancer. We'll be talking about constipation. We'll talk about stomach ulcers, heartburn, and liver disease. So those are going to be the big topics we'll speak on today. So first of all, we'll go into colon cancer. So colon cancer is a cancer that develops in the large intestine or the large bowel. Over 15,000 Canadians every year are diagnosed, and it's the second most common cause of cancer-related death. So number one is lung cancer, and number two is colon. So it's still a big sort of problem, very common cancer, and it affects people of all backgrounds. So what are the signs and symptoms to talk to your family doctor about that you should be concerned? So things that I would say that you should bring up with your family doctor is if there's been a change in your bowel habits. So if you have new onset constipation or new diarrhea or new narrow stools, for example, something that's changed, it's worth talking to your family doctor about. If you've noticed blood in your stool, when you wipe or when you look in the toilet bowl and it's red, that's also something to talk to your family doctor about. If you're losing a lot of weight when you're not trying to lose weight, that's also something to talk to your family doctor about as well. So what are the major risk factors? Like what are the causes of colon cancer and how can we sort of decrease our risk of developing cancer of the colon? So some things we can change. For example, as we get older, the risk increases. So being older than 50 years of age, you're at a higher risk of getting colon cancer. But there's some things that we can modify, including alcohol and smoking. So regular use of alcohol and smoking cigarettes really puts us at a very higher risk of developing cancer of the colon and other cancers too. If you have a sedentary lifestyle, if you're not physically active, and if you're of increased BMI or overweight, that can also increase your risk as well. If you have a diet that's very high in sugar and processed foods, that's also a risk factor. If you have a family history of colon cancer, so there's a number of risk factors that can increase your chance of developing colon cancer. So we'll talk about how to modify that risk. But before we go into that, I do want to talk about colonoscopies and polyps. So I'm sure many of the people who are here today have had a colonoscopy in the past. So the whole point of doing a screening colonoscopy is to find these lesions we call polyps. These are growths inside the bowel. They're like little mushrooms that grow inside the bowel, basically. And when we cut these out and remove them, it prevents cancer because it's the polyps that grow into develop into colon cancer. So colonoscopy is very important because it can prevent 90% of colon cancer. So very important to get that done and to have screening. So if you do develop colon cancer, it's one of the cancers that if we catch early, there's excellent prognosis. So it's a slower growing cancer. So if we can catch it early and do surgery, survival is greater than 90%. It's very good. So again, very important to be proactive and to get screening appropriately. If you do get colon cancer, we do surgery and sometimes chemotherapy and radiation, but very effective. And this cancer really responds well to our treatment. So how do people prevent colon cancer from developing? So the two ways is by doing stool testing for blood and colonoscopy. So I'll talk about each of these. So stool testing for blood, the whole point is to find invisible amounts of blood in the stool. So even if your stool looks brown, there might be a small microscopic amounts of blood inside the stool, and that could indicate you have either polyps or precancer or even colon cancer. So that's how we find it. So we recommend that you do this stool test or this poop test starting at the age of 50, earlier if you have a first-degree relative with colon cancer, and we go all the way to 75. And then after that is sort of your individual decision. If there is a small amount of blood or hidden blood on that test, there might be polyps or a cancer growing in your colon. But don't be alarmed. If you do have a positive test, it doesn't mean you have cancer. It could also be coming from hemorrhoids or a fissure. It can also be a false test as well. So we repeat this test every 2 years. So if it's normal, you don't need to worry. You just get your stool test every 2 years. But if it shows that there's blood in your stool, then you go for a colonoscopy. And that's kind of what our guidelines say in Canada of how to do colon cancer screening. So the stool test, very simple, painless test to do. I'm sure many have done this before, whoever listening. But you basically have these cards that come to you. You can either pick it up at the lab or sometimes they mail it to you. I believe Ontario has that program. So you get the stool, you get the cards, and you collect your stool in a basin, just like that. And you take usually like a little toothpick, basically, and you smear the stool on the card, and then you close it, and you can either mail it back, or you can drop it off at your lab. And they process it and they see if there's any hidden blood in there. So that is a very simple, easy, painless test to do. And we recommend at least every 2 years to get this done. So if there is blood, then I would recommend proceeding with a colonoscopy. So colonoscopy is a very common test, a very, very easy test. It's about 20 minutes. I do them commonly. You need to just adjust your diet before and take a prescribed laxative to empty out your bowels. You typically come to the hospital or the endoscopy unit half an hour before. A nurse will put an IV in your arm and you'll get some medications to relax. The test should not be painful. And then we take a small thin tube with a camera and we guide it to the end of the colon. And the colon is about 1 meter long or 3 feet long. So it's quite long. So we take a good, careful look at the bowel and see if there's any of this polyps or cancers or anything that's abnormal there, and we can see it on the screen, and that's what we do as gastroenterologists, yeah. So if we do see a polyp, so on the bottom picture, you can see that that's a big polyp there. So we have these tools that we can put in and we can cut these polyps out. And this polyp, if it wasn't cut out, it could develop into colon cancer in a couple of years, say. So by removing it and cutting it out, we can prevent that. As mentioned, it prevents 90% of colon and rectal cancers and can detect cancers early. So it can be cured and treated early before it potentially spreads. Okay, so that's a talk about colonoscopy and colon cancer screening. So we now talk about the second topic. And the second topic is about constipation. And the reason why I want to talk about this is that as we age, it's normal for our digestive system to slow. So it's more common to get constipation as we get older. There's a number of medications that can cause constipation. For example, painkillers, iron tablets, even some blood pressure pills. So there's a number of things that can cause you to become constipated. And diabetes can also slow the stomach and bowel. So can Parkinson's disease. And even having a sedentary lifestyle or not enough physical activity can slow your bowels and can cause constipation. So the first thing is to look at, if you have constipation, to look at your fiber intake. So we recommend to have at least 30 grams of fiber in a day. So those are some things that we recommend in terms of like the foods we recommend. So lots of fruits and vegetables and whole grains. But it is difficult in our North American diet to get 30 grams of fiber in the diet. And so that's why I recommend to most of my patients to take psyllium fiber. So this is, the brand name is Metamucil. You don't need to use the brand name, but even just using psyllium fiber, which is basically, it's a natural product. It comes from a tree bark. So they grind that up and it's like a fiber supplement. So even I personally take this every day with my breakfast, after my breakfast. And so it can really help to supplement with fiber in the diet if you're not getting the 30 grams. And if that's not effective, you know, the next best laxative I recommend is called Restoralax. So this is a flavorless powder. You can buy it over the counter at your local drugstore. And so having this in a glass of water or a drink and drinking that every day or on an as needed basis is a very gentle, non-habit forming laxative and very safe. So we'll talk now. So that's a little about constipation. So now we're going to talk about the third topic, which is ulcers. So peptic or stomach ulcers, these are open sores in the stomach and in the small intestine. So this occurs when acid erodes the lining of the digestive system. And typically patients will get really bad pain in the abdomen, nausea and vomiting. And if it's bleeding, you can develop this black tar-like stools. So when you get tar-like, like loose black stools that's really foul smelling, it could indicate there's blood coming from your digestive system. Because if you're bleeding in your stomach, by the time the blood gets to the end, it looks black because your digestive system has processed it. So what are the causes of ulcers? So the number one is NSAID. So this is a class of drugs like aspirin and Advil, naproxen, ibuprofen. So taking these regularly at a high dose, it can cause ulcers in the stomach. There's a bacteria as well called H. pylori. This is a bacteria that lives in the stomach and can cause inflammation and ulcers. So spicy food does not cause ulcers. So a lot of people will think that, but actually it only causes heartburn and indigestion. But again, spicy food does not cause ulcers in the stomach. So what are some complications of ulcers? Why do we worry about this? So one thing that can happen is you can develop bleeding. So as mentioned, there can be blood in your stool, or even when it's very bad, you could be vomiting up blood. It can cause a perforation or a hole in the digestive system. And when that happens, you develop severe pain, rapid heart rate, your abdomen can become very rigid. So these are all, bleeding and perforation are emergencies. So if this happens, present yourself to the emergency department, call 911 or get medical attention. So if you do have an ulcer, we can treat this with a scope. We put a camera in this way to the mouth now, and the camera can see these ulcers like in the picture there as a bleeding ulcer. And we have different tools. We have clips and things that we can inject in the ulcer. So it's pretty minimally invasive. It's not a big surgery, and we can stop the bleeding and heal the ulcer internally. If this does happen, there's medications that can heal the ulcers, like antacid medications, prescription ones like Nexium and Tecta and Period. I'm sure many people are on this for heartburn too, but that can help heal ulcers. Avoid NSAIDs if you can, and treat the H. pylori bacteria in the stomach with antibiotics to prevent the ulcers from recurring. Okay, so now we'll talk about a little bit about heartburn. So heartburn is very common. All of us experience heartburn, especially as we get older. So heartburn essentially is acid coming from your stomach that backs up into your esophagus.
Good.
Yeah.
And it's called GERD, or GERD is gastroesophageal reflux disease. That's sort of the medical terminology. So symptoms of acid reflux, you get burning in the chest or throat. You can develop a bitter taste in the mouth after eating, trouble swallowing, raspy voice, and even an unexplained dry cough. So some people can just have a dry cough, persistent cough, and that's a sign that they might have acid reflux, and that's how we sometimes can present. So heartburn is very common, but when should you be concerned and talk to your family doctor? So the times to be concerned is when food is getting stuck on the way down. So if your food is getting stuck in your throat when you're eating, you should definitely talk to somebody about that, your doctor. If you have chest pain, if you're losing a lot of weight when you're not trying to lose weight, and certainly if you're vomiting up any blood, these are times to get medical attention and to get some help. So with heartburn, one of the common questions I get is how do I change my lifestyle, and what can I do to help minimize GERD or heartburn? So the things that can really help is, of course, stopping smoking if you're smoking, sitting up straight, especially after you eat. I recommend eating small meals throughout the day. So instead of eating 3 big meals, I recommend to people who have heartburn, eat 5 small meals throughout the day. Chew your food slowly. Avoid any heartburn triggers. So things like chocolate and citrus and caffeine and alcohol can really trigger heartburn. If you're having lots of heartburn when you sleep, keep your head up with an extra pillow. So when you sleep, use 2 pillows if you're getting heartburn at night. And the most important thing is to really avoid eating or drinking anything 3 hours before bedtime. So don't eat a big meal and then go to bed afterwards, because that can cause a lot of nighttime heartburn and acid reflux. So there's medications that help, things like Tums and Maalox and Pepto-Bismol. These are over the counter. They work, but they're short term. They only work for a short period of time, maybe an hour or two. And then there's prescription drugs, which are more effective, like Tecta and Nexium and Period and Prevacid. These are some of the brand names of this class of drugs called PPIs, proton pump inhibitors. Okay, so we'll talk about now a little bit about the liver now. So that's sort of the next big topic. So about half of what I do in my practice is liver disease, so very common. The liver is the largest organ in our body and one of the most important. It's responsible for digestion, cleaning out the blood. It stores nutrients and vitamins. So it's essential to live and for the body to function. And there's many, many diseases that can affect the liver. And the 2 big ones that I want to talk about today are probably the more common ones, includes hepatitis B and C, which are viruses that infect the liver, and fatty liver disease. So as you can see in the picture, there's a normal looking liver and there's like a fatty liver where the liver becomes fatty. So we'll talk a little bit more about each of these. So let's talk about hepatitis B and C. So these are viruses. They infect the liver and they can live inside the liver for many years, decades sometimes. and they slowly sort of damage the liver. These viruses are transmitted between people mostly by blood-to-blood contact, sometimes bodily fluids. So ways to get hepatitis B is if you had a vaccine with a dirty needle, for example, if you had a dental procedure with not clean instruments, if you're body piercing with unclean instruments, that sort of are ways that you can get it. But it's important to know that hepatitis B and C are not spread by hugging, by kissing, by sharing cups or utensils, by coughing or sneezing. You don't get hepatitis that way. But it really is primarily blood to blood. So hepatitis B and C, so when you look at a map of the world, the red parts that you see there are where it's the most common. So over 7% of the population has hepatitis B and C in these places. So this includes most of Africa and much of Asia. Yeah, so these are like common places that we see a lot of this viral hepatitis. Luckily in Canada and North America, we usually have very clean things, for example, clean instruments, pardon me. Like if you go to a dentist or you get a piercing or a tattoo, it's usually we have quite high standards. So it's unusual in Canada to get hepatitis B and C by that way, but it's still possible, but less likely. So what are the symptoms for hepatitis B and C? So in liver disease, typically you don't develop symptoms until it's very late, unfortunately. So when you develop cirrhosis or really damage of your liver, you can develop yellow eyes or jaundice, swelling in the belly, confusion. You can develop easy bruising and bleeding. So these are the signs of a condition called cirrhosis, or really sort of damage of the liver, permanent damage of the liver. So unfortunately, these signs develop at the end stage of the liver disease. So these viruses are kind of like silent killers, really. Like, so we have to detect it early on. And how do we do that? So to test for hepatitis B and C, you have to just simply talk to your family doctor and get a blood test. It's a very simple test to see if you have this virus living inside your liver. So I recommend everyone, regardless of wherever you're born, you should get this test done at least once in your life. Because some people have this virus living in their liver for 20, 30, 40, 50 years without them knowing. And it's important to find it and to treat it before you develop cirrhosis of the liver. The other most common problem with liver disease I see now, very common, is fatty liver disease. So fatty liver disease is also, the medical terminology is NASH. So NASH, it's a big word, but it's called non-alcoholic steatohepatitis. But that's just the medical term of fatty liver disease. And this is where fat builds up inside the liver and it causes inflammation and eventually scarring or cirrhosis of the liver. And as you see in the picture there, that's a healthy liver. And on the other side, that's a fatty liver. So that's where the liver has been full of this fat and it causes a lot of inflammation and damage in the liver. It's very, very common. So what causes fatty liver disease? So there's certain things in the diet, like if you have lots of sugar in the diet, for example, if you have high cholesterol, if you have diabetes, if you're overweight, and even certain ethnicities as well are a little bit higher predisposed to developing a fatty liver, including South Asians and Filipinos, for example. So these are sort of the causes of fatty liver disease. So if you have diabetes, you're overweight, you have high cholesterol, you should get checked for fatty liver disease too. I do want to just talk briefly about alcohol in the liver as well. So, since the pandemic, my practice has changed as a liver specialist. I see a lot of alcoholism, much more than I ever did in the past. And this really affects the senior community as well. I think that a lot of times, like studies have shown that what drives drinking a lot of times, especially in our senior community, is social isolation. So stress, social isolation, loneliness, depression, this can sort of lead a lot of times to hidden alcoholism. And I see a lot of it in my practice with elderly patients who are drinking and developing cirrhosis from alcohol. So it's a big problem and a growing problem. And our new guidelines in Canada, they recommend that to not have more than 2 drinks in a week. So this is a big change compared to before. Before we would say that, you can drink much more than that, 10 to 15 in a week. But the new guidelines say that you can only drink 2, because drinking anything more than that, like 3 to 6 drinks, really increases your risk of cancer, heart attack, stroke. It's a major problem. So so that's sort of something just to watch out for. So to be very careful with alcohol intake. Because even having that glass of red wine every night, the previous teaching was that, oh, that's good for your heart, but it's actually been debunked. It's not. It's not really good for your heart. Actually, it increases your risk of heart attack and cancer. So just be careful about your alcohol intake. So as mentioned, the signs of fatty liver disease, it really is things like jaundice, confusion, easy bruising. These are all signs of developing cirrhosis of the liver or damage of the liver. So it's important to recognize that if you have fatty liver, to prevent it from developing into cirrhosis and getting some treatment. So what are the treatments? So the main treatments is, if you're overweight, to slowly lose weight. So that should say no more than 3 pounds per month. So it should be a gradual weight loss, and do it slowly with a good lifestyle. Treat your blood pressure if you have high blood pressure. Treat your cholesterol. This also reduces the risk of heart attack and stroke, which is very closely associated with fatty liver disease, and avoid excessive alcohol in the diet too. So these are all ways to prevent fatty liver and to treat it if you do have it. So it's very much a treatable and reversible disease. So one of the big questions I get as a stomach and digestive system specialist is, what should I be eating? Like, what's the best diet and the healthiest diet? So this is a great picture from the Canada Food Guidelines, which tells us what is sort of like the ideal diet to prevent disease and cancer. So basically what the guidelines say is that ideally half of your dinner and lunch and breakfast plate should be vegetables and fruit. It should be greens. A quarter of it should be a protein, and a quarter of it is a whole grain. And the guidelines also suggest that make water your drink of choice, as opposed to fruit juices and pop and sweetened drinks, to substitute that with water whenever possible. So I always recommend to patients to try, if you can, to eat more plant-based protein rather than red meat. Red meat is fine to eat, but I always recommend not eating it more than once a week, to eat it in sparingly, because red meat is associated with a heart attack and all these other bad outcomes. So use it as a treat, not to have it on a daily basis. But the best sources of protein is things like beans and lentils, tofu, and nuts. Those are like healthy sources of protein in our diet. As I mentioned, try to drink more water and less pop and juice and sweetened drinks. Perfect. So we'll do a little quick summary, and then we'll open it up to some questions. So the take-home messages from this presentation. So again, if you're between 50 and 75 years of age, make sure that you get a FIT stool test to look for blood in your stool. If there is blood or you have any symptoms, you need to have a colonoscopy. And this can prevent colon cancer. And if it's found early, there's good treatment for colon cancer that can save your life. So definitely be proactive if you have any symptoms, and to remind your family doctor if you're not getting the stool test done, because sometimes they're busy and they forget, right, with other medical issues. So just to remind them about colon cancer screening. Constipation. So try to have 30 grams of fiber in your diet. And if needed, supplement with psyllium fiber or Metamucil. Drink 1.5 liters or 6 cups of water daily is what we recommend. And try to stay active if you have constipation. Walk, even just for a half an hour walk, or even the chair exercise you guys were doing earlier. These are all excellent ways to sort of keep the digestive system healthy and your bowels moving. Ulcers. So we talked about ulcers. This is caused by anti-inflammatory drugs like NSAIDs, and also H. pylori. It's a bacteria that lives in the stomach. If you have symptoms of severe pain, vomiting blood, or you have black tar-like stools, those are medical emergencies that you should present to the emergency department because you might have a bleeding ulcer in your stomach. Heartburn. So eat small meals throughout the day. Don't eat right before going to bed. Losing weight can also help a lot if you have terrible heartburn. If you have nighttime heartburn, sleep with an extra pillow. And then talk to your family doctor about prescription pills that can help. And just be aware of those alarm features we talked about. If you can't swallow your food and losing weight, to talk to your family doctor about that. Liver health. So to keep your liver healthy, eat lots of vegetables and fiber. Watch your weight. Exercise regularly. Make sure that your diabetes and your cholesterol and your blood pressure are well controlled. Don't drink more than 2 drinks in a week at most, and get tested for hepatitis B and C at least once in your life if you haven't gotten that tested. Perfect. So we'll open that up to some questions. Thanks.
Thanks, Zamil, for that really comprehensive presentation. I didn't know so many parts of the body were connected to the gastrointestinal system.
Yeah.
And it's really interesting to hear the new guidance for alcohol consumption and red meat consumption, less than 2 drinks a week or so, and red meat once a week. Any thoughts on maybe the health benefits or risks of having things like a diet soda or not unsweetened soda?
Yeah, it's a great question. So yeah, the question about sort of substituting with diet drink. So I mean, I would say that compared to a regular, for example, if like a Coca-Cola, to have a regular Coca-Cola or a Diet Coke, I would say if you're going to have one, probably choose the diet. But there are some newer studies that say that a lot of these sweeteners, like aspartame, it could be harmful in high doses. And it can be associated with other problems as well. Yeah, sort of with a lot of research being done in that, so we don't really know a clear answer. But I would say that, yeah, it's the diet option is probably a better option, but even a better option would be, if you can, on a day-to-day basis, to substitute with water. And then have an occasional kind of pop or juice, but use it as kind of like a treat, like once in a while, not on a daily basis. Yeah.
Is ginger ale better?
Yeah, ginger ale, like if you look at the ingredients in ginger ale, there's a lot of sugar. And there's a specific type of sugar in ginger ale, like, the Candace ginger ale, it's fructose. It's like a sweetener that's particularly bad, actually.
What if you put a lot of ice in?
Even if you put a lot of ice in, there's still quite a bit of sugar in there. So I would say that definitely enjoy the ginger ale once in a while, but I wouldn't be having this on a daily basis.
No,
for sure. Yeah.
no, once in a while. What about iced tea?
It depends. So iced tea can be made in a healthy way with like tea and with lemons.
Green tea?
Yeah, that's fine. But when you buy a lot of the store-bought iced tea, the sweetened one, there's a lot of sugar in there.
No, but you can make it at home and put lemon and mint and a little bit of honey, good unpasteurized honey.
That's a great option, yes.
So we had a couple of questions in the chat. First one's asking if you could say a few words maybe about irritable bowel syndrome, how it relates in the gastrointestinal system.
Yeah, so we'll talk a little bit about IBS, or irritable bowel syndrome. So irritable bowel syndrome essentially is what I describe as it's a nervous gut. So it's about 10% of everyone has IBS, so very common. Essentially what it is it's a condition where you develop a lot of pain, bloating, diarrhea, and constipation. And the underlying issue is about the nerves in the gut. These are irritable. And so a lot of times when you're stressed, you're not sleeping well, you're upset about things, you'll feel it in your gut with pain and bloating and altered bowel habits. And so it sort of is basically like a stress response of the body. And that's IBS essentially. So the treatment is sort of like a big topic, but that's something to just discuss with your family doctor. But IBS, or irritable bowel syndrome, is a diagnosis of exclusion. So meaning that it's you should have all the tests done to make sure it's nothing else. And if all the tests are normal, then you can come up with a diagnosis of IBS.
Okay. We had another question in the chat. Is it true that after having a colonoscopy where everything was diagnosed or no problems were diagnosed or detected, that it's not necessary to have the FIT test or the poop test for 10 years?
Correct. Yeah, that's exactly right. Yeah. So basically, when you get a colonoscopy and it's normal and it was a well-done study, you're good for 10 years. And then after 10 years, that's when we recommend you start the stool test again. Correct. So getting that colonoscopy, it gives you like 10-year warranty. Yeah.
Okay. Okay, that's good to know. And another question we had was there's sort of a trend I've heard, and I guess other folks have heard too, about having intermittent fasting and smaller meals. And any sense of how that would relate to gastrointestinal health?
Yeah. So the intermittent fasting is something that's become more common, more popular. I would say that there's not really any clear studies that show that it's of benefit. I mean, a lot of people who are overweight who do intermittent fasting do notice that they lose weight, which is great. But I always say that make a change that's sustainable long term. So a lot of these sort of fad diets that we do, whether it be keto diet or intermittent fasting or this or that, it's hard to keep it up for years and years. So if you do it for a short period of time and you lose weight, but you go back to a normal diet, all of that, the gains will be lost. So it's something to keep up permanently. So a lot of times intermittent fasting, it's tough to keep it going for years. So I think that it's a little bit better what I recommend is to look up the Mediterranean diet. That's sort of the diet that's best studied for sort of a healthy heart, healthy brain, healthy liver is the Mediterranean diet. Yeah, and it's easier than doing intermittent fasting. Yeah.
Okay. I just had another question here. Okay. One person's asking, what are your options when your colonoscopy was incomplete after two trials or two scopes trials?
Yeah. So sometimes it's rare, but sometimes we can't complete the colonoscopy for a number of reasons. One reason can be sometimes people's bowels, their intestines are very twisty. So we can't get that camera up a meter long. It's rare, maybe happens in like maybe 1%, I would say. The other options is to do a special CT scan or CAT scan of the bowels. So that's very widely available, especially in Ontario as well, of course. But so if you've tried repeatedly, it's incomplete, is a special CT scan. It's called a CT colonography.
Okay.
Yeah.
Okay. And I remember you mentioning throughout the presentation, NSAIDs, that type of I guess medication that can cause problems in the gastrointestinal system. Am I right? That's things like aspirin and that new ibuprofen type drug.
Correct. Yeah. So these are very common drugs, and the class of drug is called NSAIDs or non-steroidal anti-inflammatory drugs. So this class of drugs, essentially, they're anti-inflammatory. Is used for pain, but also is used for people who have heart disease, like taking a daily baby aspirin, for example, or if you have bad arthritis, for example. So, and these medications are safe. I certainly wouldn't say to stop it. But when used daily at a higher dose, it does put you at increased risk of developing stomach ulcers. So there are side effects associated with the NSAID use. So to use it in moderation, and if you do have to use it daily for a medical condition, whether it be pain or heart disease, to just be aware of those alarm features, the severe pain in the abdomen or the bleeding. And if this does happen, to definitely get medical attention right away.
Okay. Wow. I'm just speaking from my personal experience. I remember when I was a little kid, if I'd have maybe aspirin once or twice a year if I had a fever or cold. And I took aspirin last year once, and boy, oh boy, it did a number on my stomach, which I never remember having happened when I was a youngster. So
there you go. Yeah, totally. Yeah, it can definitely do that. Yeah. And I always recommend that if you have aches and pains and other issues, if you had to choose between sort of Tylenol or Advil, I would probably choose the Tylenol. because Tylenol, it can help with the pain, but also it doesn't cause ulcers and stomach upset. So sometimes I lean away to say Tylenol if it works. Yeah, it's a little bit safer.
Okay, very good. Good. Are there any other questions, folks, among our attendees?
I'm just going to ask the question that I've heard that Tylenol is bad for your liver.
Yeah, it can. That's a great question. So Tylenol, it can, I mean, all medications do have, of course, their side effects. Tylenol, when used at a high dose, it can be very toxic for the liver. So a high dose of Tylenol is anything more than 4 grams of Tylenol a day. So for example, like an extra strength Tylenol, like a really strong one, is 1 gram. So you need to take 4 of those extra strength tablets or 8 of the regular Tylenols in a day, and then you could possibly cause toxicity to the liver. So you have to use a pretty high dose. But using like, a couple tablets here and there, like is totally safe. But using it at a very high dose, more than 4 grams a day is it can be detrimental or harmful, yeah, to the liver.
Have you heard the term, they've changed the word NASH to MASH?
Yeah, that's right. Yeah, that's the most recent.
I thought that was interesting. I have cirrhosis of the liver, stage 4. And there really isn't anything that I can take or do or whatever, not knowing at all that I even had it. So of course with NASH, you always get that label, how much do you drink? And those of you who know me, I only drink water. I've always just had water. And so it's very maddening between the Tylenol, all these things and what to do at this point. I don't know. I'm not doing anything. I'm just living.
Yeah.
The other thing I was given is told to have 4 cups of coffee a day, which I don't do, but do you think that's a good idea?
Yeah. So sorry, yeah, that's developed. And this is a common story, Lucia. Like we see it so often that people who are living the regular life and they develop cirrhosis of the liver just out of the blue without feeling anything. And this is kind of the thing with liver disease, is that you don't develop any symptoms until you develop cirrhosis, unfortunately, but and it's very common. So in terms of sort of managing fatty liver disease, you're right. The new label is MASH, called metabolic associated steatotic hepatitis, but it's associated with things like diabetes and cholesterol and hypertension and being overweight, but also there's a hereditary component to it too, which is what I was saying, that there's certain ethnicities that are more predisposed. If you have fatty liver disease, it's likely that your mom and dad probably have fatty liver disease, so there is some hereditary component. And there are good treatments, even when you develop cirrhosis, to prevent it from progressing further. And the things that we recommend is healthy diet, as you're doing, things like the Mediterranean diet.
Yeah, well, we were Italian, so we use that all the time. I think that's what really kept us going in a sense that way. But fatty liver, from what I've understood, is 1 in 4 people have it.
Yeah,
and you would know it. So it could be everyone in this panel who has it and would know it. So this is something that I don't know what we can do as far as research and why would it cause it. And I don't know, like what it's just mind-boggling half the time, because I go every 6 months for ultrasounds and blood work, and it just came out of the blue. All of a sudden you have this. What? What do you mean?
Yeah, it's a growing problem.
I would say, like, everyone here, get tested your blood work.
Yes.
And see if you have the fatty liver.
Great suggestion.
Cheryl, do you have a question?
Yes, I don't know why. I think my questions went to Audrey, but my question was this about psyllium and Metamucil. Does that interfere with any other medications?
Yeah, it can. Yeah, it's a good question. So, I mean, using Metamucil or psyllium is very safe, very few side effects. It is considered a natural product, but I wouldn't take it with your pills directly, because it can sort of bind up your pills. Because if you've ever seen Metamucil, it kind of becomes, if you leave it in the glass, it becomes really thick. And so it can affect the absorption of your pills. So if you're going to take Metamucil, don't take it along with your pills at the same time. Just separate it.
Okay, thank you.
No problem.
Yeah, I put some fiber on my oatmeal or cereal in the morning, sprinkle a little bit on top. I'm hoping that's helping me.
Yeah, that's great. Great suggestion. Yeah.
Anyone else have any questions, folks?
Yeah, I'm just wondering if you could comment on the instructions that come with Metamucil that say to stop using it if you get bleeding from the rectum from by using it. What in Metamucil causes bleeding from the rectum?
Great question. Yeah, I think that the reason why that's on the label, as many things are, right, for I guess liability reasons, is just to say that to get medical attention if you do have blood in the stool. Metamucil doesn't cause rectal bleeding, and there's nothing in it that causes bleeding. And in fact, if you have bleeding from hemorrhoids, for example, I recommend starting Metamucil, because one of the best treatments for hemorrhoids is having a high fiber diet and to avoid constipation, right? So I would say that there's nothing that causes it. The label would say it just because they want to prompt you that get medical attention if you have blood in the stool, but it's not the Metamucil causing the blood in the stool.
Wow, this has been amazing. Any other questions, folks? We have the year of this expert.
So for fatty liver, it's really a blood test?
Yeah, it's a blood test. And what the blood test is checking for is your liver.
What kind of blood test is it called?
Yeah, I would ask your family doctor to check your liver enzymes.
Liver enzymes.
Liver enzymes, yeah, that's the best test. And if your liver enzymes are high, indicating inflammation in your liver, then the next step is an ultrasound of your liver, taking a picture of your liver. But the first test is liver enzymes. So if you maybe mention that, yeah, next time you see your family doctor for your annual checkup, to get your liver enzymes tested. It's just a simple blood test.
And the next one, I'm sorry, I didn't get that.
Oh,
after that is
ultrasound of the liver.
Okay.
Yeah, you get an abdominal ultrasound.
Okay, thank you.
No problem.
Wow. Well, I think we've answered all the questions in the chat. This is a really informative presentation. I learned quite a bit.
Wonderful.
No problem. Happy to help.
Yeah, thank you for taking the time to speak to all us retired folks here. It's knowledge, as Nazma said to me many times, knowledge is power, and it's great to be more informed about how to make our lives better and healthier. So thank you so much. I wanted to mention to everybody, we have there's a survey connected to this event. So as you leave, within a few seconds, you should be presented with a survey. You're welcome to fill it out and give us feedback so we can keep trying to make these events better. And it's great to connect with you from all the way across the country in British Columbia. This is wonderful. We have this technology that can make this happen. So we really appreciate your time. Thank you so much.
Happy to help.
Yeah, very grateful. Yes, grateful.
You're welcome. Thanks, guys. Yeah, thanks for having me. I appreciate it.
Thank you, Zamil. And I will get the presentation out to us, and then we'll forward it to you guys later on.
Will do. I'll send it to your way.
Okay. And remember, this is taped, so we will put that out on our YouTube, where you can go and listen to it again whenever you guys want.
Wonderful.
Exactly.
Yeah, and our next Zoom presentation is on June 25th on diabetes and dietitian.
June 25th?
Yes.
Yep. Yeah, you're welcome to register now, and we can we'll get the Zoom meeting details to you shortly before the event.
Okay.
Okay, is there any other questions we can answer? No? Yes?
Very good presentation. Excellent.
Thank you.
Excellent, for sure.
Thanks, guys.
I'm going to be making a lot of changes.
Oh, good.
I'm sure we all are. I'm sure we all are going to make changes.
Glad to hear it. Yeah.
Okay.
Okay, we'll let Dr. Karim go, and everybody can start our weekends. Thank you again so much for the time.
Thank you.
Bye-bye.
You're
everyone.
welcome.
Have a nice weekend.
Bye.
Thank you.
You too.
Bye-bye.
Bye-bye.
Thank you. Thank you, Nazma.
You're welcome.
Yes,
Take care. Stay
thank
safe
you.
out there. Yeah, you're welcome.
Really appreciate it.
Anytime.
Excellent.
Thank you.
If let's say after this, if we have any other question, can we pass it off to Nazma to ask?
Yes, that's fine with
Okay.
Zamil. Yeah.
Okay. Thank you very much.
Yeah,
No
thank
worries.
you.
Anytime.
Most
Anytime.
appreciated.
Anytime.
Yes, thank you.
Thank you, Nazma. Excellent
Thank you.
presentation. Thank you.
I'm glad you enjoyed it.
Really
We did. Thank you.
Bye.
Bye, Naz.
Bye, Sheila.
Take care, folks.